Live on Your Health Now, a case of stomach sores is slowing down the boss. Bruce Springsteen announces that he's postponing his concert tour to get treatment for peptic ulcers. And here to answer questions is Dr. Kyle Stoller, a gastroenterologist at Mass General Hospital. Thanks for joining us, doctor.
Thank you very much for having me.
All right, many of us have heard of an ulcer before, but what exactly is a peptic ulcer?
Well, the thing to think about is that the stomach is full of acid. And the stomach has really elaborate defenses to keep that acid from causing damage to the lining of the stomach. And when those defenses go down, that's a peptic ulcer. So you get an erosion in the wall of the stomach, and it can cause a variety of things. Most of the time, actually, it doesn't cause anything. We don't get any symptoms, nothing. The patient doesn't even know that they have it. But in some cases, it can cause pain or nonspecific symptoms, kind of like indigestion. In other cases, it may cause bleeding because it affects a blood vessel, and then that's why the patient knows that they have it. And lastly, it can actually perforate or actually cause a tear through the lining of the stomach, which you can imagine can be quite serious.
Yeah, for sure. So let's be clear. Of course, Springsteen is not your patient, but if he was, what would you tell him about how to treat this and different behavior?
Well, I think, the big thing to keep in mind is that you need acid to have ulcers. And so taking an antacid medicine, specifically a proton pump inhibitor, is very effective at helping to heal ulcers. The other thing is that most ulcers, in fact, almost all ulcers, are due to two causes. One are medications called nonsteroidal drugs. And these are things like Motrin, ibuprofen, Advil. They can actually weaken those stomach defenses, and that can lead to ulcers. And the other thing is actually a bacterial infection. It's called Helicobacter pylori. And that also weakens the stomach's defenses. So maybe he needs an antibiotic course to eradicate that bacteria, and he likely needs to back off on some of these very effective pain medications, many of which are over the counter and many of which people don't understand can actually cause some real complications. One thing, though, that many people think he should avoid is that we commonly think of ulcers as being caused by stress or spicy foods, things like that. In fact, there's really no evidence that those are dangerous at all. So the boss can continue to eat as he wants to.
And we know, Dr. Stoller, that he's canceled all his shows through September. How long does recovery typically take?
I have to say it's actually a little surprising that he's canceled shows specifically for this, because the recovery in many cases is quite quick because these acid-blocking medicines are very effective. You do wonder if there was a potential complication like a perforation or a tear, then recovery can actually be quite extensive and he would need to be hospitalized.
All right, Dr. Kyle Stoller, thanks so much for your time. We appreciate it as always.
Thanks for having me.